Epistaxis is a condition where some people may experience that there is blood coming out of the nose. In the younger age group, the commonest reason is that they may have had a cold or a upper respiratory tract infection. Then they just try to blow their nose forcefully, and then they may be experiencing some blood coming out. Or another common reason which we have seen in young children is that they may have put some kind of a foreign body, like some rubber or a pencil or paper in their nose. Then that if they don't tell anybody or the parents have not come to know, then that foreign body may stay in their nose for some time and lead to some infection, and then there may be experiencing of bleeding in those cases. As we grow in a little older age group, then little older adults, then the common causes are like there may be a road traffic accident, or they may have fallen down while playing, or some sports injury. Then injury to the bridge of the nose can cause fractures over here, and then the person may get nasal bleeding. Another reason is that some many of the people have a what we call as a crooked nasal septum, which in our medical terms we call as a deviated nasal septum. In these people, the bone inside the nose is crooked. So then they are not able to breathe correctly from both their nostrils. And then these people have a tendency to get frequent colds. When you get frequent colds, the skin inside our nose becomes very delicate and fragile. And then any kind of a little forceful blowing of the nose or some kind of a push on the nose, then the nose will start. Then coming to sometimes they may also have polyps, tumors inside the nose. Then there is bleeding. And in the elderly age group, the most common cause is if they have hypertension, shooting up of the BP can lead to nasal bleeding. That's the most common in the older age group. Sometimes the first symptom of being having hypertension is that they start developing nasal bleeding, and we have to check the BP. And then you come to know that the BP is high, and so the bleeding is happening. So you have to treat the blood pressure. There is something like we call as anterior nasal bleeding and post nasal bleeding. The anterior nasal bleeding is when the blood starts coming out from the front of our nose, like from our nostrils. Then post nasal bleeding is our nose is connected to the throat. It's just the nose is divided from the throat by the hard and soft palate, but it is connected through our oral cavity from the back. So sometimes if we pinch our nose and don't let a nose to come out from the nostrils, it may flow backwards into the throat, and that is called as postnasal. The first aid is that you should ask the person to lie down, put a pillow, two pillows under their head. You have to get ice quickly and put it on the top of the head and put it on the bridge of the nose. You have to pinch the two nostrils and pinch them tightly so that the blood, if there is blood coming, you can try to stop it that way, and tell the person to breathe from the mouth. Nasal bleeding is what we call as a symptom. It is not the diagnosis of any condition. It is we have to find out what is the reason why this bleeding is happening, and then you treat the cause and the bleeding will stop. It's not a permanent condition. If you have high BP and you're getting nosebleeds, then you make sure that you regularly visit your physician and make sure that your BP is under control. If young children, if they have a cold or cough, you have to treat it properly. If you feel that if they've had an accident and there's bleeding after that, then one has to. And if there's a fracture in the nose, you have to treat the fracture. If there is a deviated nasal septum and that is causing them frequent bleeds, then one can correct the nasal septum with surgery. If there are some swellings in the nose, then you have to treat that, and then the bleeding will stop.